Does everybody know what October is? October is what awareness? Cancer awareness, right? It's like the whole month is dedicated to cancer, right? And so usually people start looking at things that they need to do for cancer, right? And so what's the number one thing that we usually think of for cancer? We usually think of breast cancer, right? And then what's the test that people, mammogram. So I'm going to dive into that as well tonight. How many of you have ever had a thermography done? So we have a couple people. Okay. If you had, did you have thermography? Okay. Perfect. She wants you to be here for that. You see the guy here, that's actually a man getting a thermography, so it's not just for the breast, so you're in good company. Your wife sent you to the right place. I actually love the thermography because I think it's one of the best tools that you can use to be able to detect any types of organ dysfunction, not just cancer. And it's not just for the breast. That's another really important thing. I think the mammogram is really just for the breast, but this is a fantastic tool that you can actually use to be able to test all the organ systems. I have had men who find us on Instagram travel hours to come to our office because they've watched some of our stuff that we do on YouTube, and they've seen me do the talks and wanting to come in just to test to make sure their prostate was okay. And so it's been a really good tool to be able to evaluate that. I want to show you guys how it works and basically what we use to have it work. Why don't I have come up here for just a second for me? You mind being my guinea pig? Okay. So I want to just show you on him that this is the probe that we use. This probe is actually attached to a computer, and what it does is it takes measurements, okay? So you'll come in and we'll do 2 tests on you, and you'll prepare your body. There's some things that we'll need to do before the appointment, okay? And we have some paperwork on that, what you need to do as far as making sure that your body is prepared. One of the things is you want to make sure your glasses are off for a little while before, because you want to make sure that you don't have that indention right from your glasses. Ladies will take the bra off, before that, so we don't have any indentions from the bra. And we want to make sure we don't have really tight clothing on, okay? So those are some of the things that we'll do to prepare, but again, there's a list of things to do, things to eat, things like that, just before the appointment. But as you can see on here, these sensors right here, and so what we do is, I'll just have you stand and face toward me. What we would do is we would take the sensors and we would just touch the body like this, and we would just go along the body and test some different points. So we'd go down the face, and you can see how gentle, how does that feel gentle to you? Mm-hmm. Yeah, you can see how gentle it is. We'll go along and you'll test along where the teeth are. You can see here. We'll test along where the teeth are. In fact, I'm going to explain to you about the importance of having healthy teeth. You guys are going to be so shocked. I remember growing up, my mom used to say, take care of your teeth, and wait till you see what I talk about tonight about your teeth. You guys have heard that? Like, what do they do for a horse when a horse has bad teeth, right? They kind of put it down, right? And then you'll test in here, and what gland do you find underneath here? Do you guys know? Thyroid, right? So you'll test the thyroid, and then you'll go down the chest. So for women, we'll do an in-depth study of the breast. And then actually underneath there, we'll test all the organs. So just think about all the organs that you'll find right in here. Then we actually do test right here in the arm. And then you'll turn around after we test this whole region, and we'll test the kidneys. So we'll do the back and we'll test the kidneys. And so we have these probes basically on all these parts of the body. Thank you so much, you're awesome. Does that make sense? So we're using this, and then you'll see this amazing printout, which I'll show you, that really explains all of the organ systems in the body. I have like a little sample report here, and you can kind of see the report, how it shows you can kind of see different colors on there. So it shows you the sensory, what it measures, and the discolorations of different organ systems and where there might be challenges and problems in there. We have one for the teeth, so you can see different issues with the teeth. You guys can probably see from where you are some of the teeth that may have issues, right? In fact, I'm going to tell you a little story about a patient who came to me with teeth issues. And you can see the breast study. So for the women, you would see the breast. For the men, you would see the prostate study, okay? And then we actually have more of the organ system breakdown. And you can kind of see red. Red's usually the area that we pay most attention to, right? The one that we're most concerned with. But it breaks it down by organ system. This tests for 100 different points. And one of the things that's really important about it, if you think about the MRI and you think about mammogram and even ultrasound, some of these tests that they do, these tests are anatomical tests. So basically they're going to check the anatomy. What is wonderful about the thermography is it is a functional test. What I want to know is how is the organ functioning, right? That's what we want to know. So it's one of the best tests that you can do to test the function of an organ, and it's not invasive. Like you can see here, I didn't take the breast and smash it down like they do with the mammogram if you ever had that done. It's not invasive. And so that's what's really wonderful about the test. Now, what is the test like? Again, plan on about an hour. It's about 20 minutes for the total test part. But when you come in, you'll have to do some things to prepare your body before the appointment. We'll do the first scan, then we'll have you sit in a cold room and disrobe, and then we'll actually do the next scan. So we want to make sure to test both sides, and that measurement gives us consistency, right? A measured consistency in the evaluation. Here's what I love about it. The three things that you'll see here on the left-hand side that we use it for, I use this for every single time on every single case. The first thing is for early detection. So we'll use thermography to evaluate things and test them so we can see things show up early, right, for early detection. I had something as simple as a patient came in here, I did her scan, and her scan showed severe sinus. Sounds random, right? Severe sinus. But the thermography showed sinus, and it showed that she was, I said, are you having any sinus issues? And she said no. So she kind of poo-pooed the test. She was like, whatever, this test is ridiculous. 2 weeks goes by, remember, early detection. 2 weeks goes by, see her in the office here, she's snotting, she's got snot rags all over her. She's just a mess with her sinuses. Now what did that tell her? The test was accurate, she didn't believe it. She was headed for something, but because she didn't change course, which we address that when I go through these tests, you change course. Whatever the test tells you, we've got to make some course corrections, and that's what we do in the office through the 5 essentials that we teach in the office. And so it may be a nutritional course correction, it may be a detox course correction, it may be a dental appointment course correction, but we've got to make some course corrections. And she didn't, but it was one of those really eye-opening things that the test is so sensitive that it's fantastic for something early detection-wise, okay? Now the other thing that I love about it is it identifies root causes of illness. I'll tell you when we go into the teeth study here in just a second, the root cause of illness. One of the things that's so dangerous a lot of times about some of the testing that the quote medical model puts you through, like your yearly this and your yearly that, right, is that it doesn't identify the root cause. So they might say, okay, you have, a tumor in your breast, but how did it get there? We don't go down that road of how did it get there. And I have had patients in the office who they come to see me and I go in the exam room and they're like, Dr. Kimberly, I have a mass on my breast. I can feel it. Can you check? Yes, and I see it. Yes, there's clearly a mass on her breast. And I do the test. And the thermography comes back and it shows that she literally had an infected tooth. That infected tooth actually drained the infection down into her breast. Now that's the right thing, because that was where the lymphatic system was draining to, right? So her body was doing the right thing, right? We think of it as, oh no, there's this mass on my breast, I must have to chop them off, right? And do chemo and radiation, right? That's what the standard medical model will teach us. But what we like to do is we like to say, well, what was the cause? How did you get that mass in your breast in the first place? That's what we like to do, is get to the cause of the situation. And in her case, when she went into the dentist found the infected tooth. She had had a root canal that one of the roots had actually had an infection in it. And so what she did was she had it treated. The infection was cleared up, and then months later when we retest, the mass is gone. Now think about that. What would she had done? first route she probably would have done at the very minimum, she would have had a mammogram, right? And then the second route at the very minimum, she would have had a what? A biopsy, right? Which, and did you know that you stick a needle in tissue that can break the membrane around it and cause any infection to spread? So you set yourself up at risk for any infection that may be encapsulated and doing what it's supposed to do to spread. And that's why a lot of times really discourage you from having biopsies because of the spread, right? So she would have at least gone down that road. Now she could have set herself up for a future breast cancer, right? Because she messed with something that was actually her body doing the right thing. It was draining an infection. The infection was going along the lymphatic route, and it drained into the breast tissue. Now, breast tissue is made up of mostly what? Fat, right? And so toxins are stored in fat. She's like, I can live. It's all toxic. Wait, girl, it's all toxic. Right? So toxins are stored in fat cells, right? So many times we can't lose weight because we have some toxicity issue. We may be trying to lose weight, but we have a toxicity issue. And until we remove the cause of the toxicity, the fat's not going away. Now, many times that fat is there to do the most important thing, which is to protect your nerve system. Because the nerve system is a system that controls and coordinates and relates all function and healing in your body, right? So in this case, her body was doing the exact right thing. She had an infection in her breast, but the breast wasn't the issue, it was a tooth. Can you guys see how that's related? So that's one of the other things that I really love this test for. The other thing is it's to guide and monitor treatment. So for example, I can have a patient right now that I'm working with. I'll walk you through her history. It's very interesting. We just did her thermography, and she came in to see me for her yearly, because we do yearly thermography in here. So a year ago, she did her thermography, and she did her updated thermography. There wasn't really anything that she was concerned with. We just did the thermography. Well, interestingly enough, no, actually, take it back. There was one thing she was concerned about. I'll tell you about that in a second. We did the thermography. She actually came to see me, and she had one of her breasts, her left breast, was oozing and leaking like an infection out of it. And it wasn't coming out of the nipple. It was close to the nipple. So the infection was coming out of the breast. Now, we did the scan. 1 year prior, nothing was in her breast. Everything was clear. But remember, if we go back to root cause, I did her test, and I'm holding her test here. It's interesting. I did her test, and her test says severe level of apparent and general toxicity present. So when I go through her evaluation and we talk through it, I say, what is the severe level? What recently? Because this wasn't on your last time. The breast didn't have an issue a year ago. And this stuff doesn't show up as suddenly a severe case in the breast if there isn't something that you introduced into your body of some kind that created it. Like in her case, it was toxicity, right? So I said, what did you do? Did you have a procedure? You know, what's happened in this past year? She said, well, about 6 months ago, I had to go in for a surgery on my left eardrum. And when they did the surgery, they punctured something. And the guy couldn't control the oozing that was coming out of her ear. So what they did was they stopped it up. They kind of plugged it. So whatever was coming out was trying to drain, and the doctor plugged it so nothing more would come out, right? So what does the body do? It finds another route, correct? You got it. It found another route. It had to come out. Whatever was in there through the process of the surgery that they did created an infection, and it actually was trying to make its way out of the body. And the doctor said, this is too messy. The surgery is going too messy. I can't see what I'm trying to do, so plugs it up. So the body did exactly what it should do. It tried to find another route to be able to get rid of the infection that was in there, right? And so her test comes back severe and apparent general toxicity. Well, guess where the toxicity was? It was right in here. So the breast isn't the issue. The breast is doing the body's doing exactly the right thing. It's trying to get rid of whatever's going on with her. And so this is brilliant, you know. Now, had she not come in and done the scan, we never would have said, hey, you know, what's the toxicity? Like, what kind of procedure? What'd you do? Because you didn't have this going on a year prior. We would have done what? They'd have gone in and they've done the same thing that we just talked about a second ago. That's the traditional process, right, that they would go through. So this was a really incredible test. Now we've got her going through trying to dump all these toxins. We got to get her to go back to the doctor and see what's going on to try to unplug, you know, whatever he put in there. Maybe the body's having a reaction to whatever it is. I don't know. But anytime we run the risk, right, whenever we have a procedure done of entering something foreign into the body that the body's like, I don't want, right? So many times, you know, we probably would be better off had we not had some of these procedures done, but, you know, in some cases they are serious. We have to do them. So that was the kind of case, that was the situation in her case. So anyway, now what we're doing is we're using it to guide and monitor. So we're finding the cause, we're using it to guide and monitor treatment. So I've got her on several very important detox protocols. Now, what are your detox organs? Think about the organs that you have that do a natural job, the natural job of detoxing. So we said liver, right? That's the liver. What else detoxes? Kidneys, right? What else? Skin. Well, her breast is doing the job, right? What is the other? Say it again. How about digestion? Right? Digestion, right? And then how about respiration? Right? So interestingly enough, all those areas on her test showed up as being clogged. So imagine your body is trying to dump toxins, the kidney's not working good, the liver's not working good, and the colon's not working good. The body's going to find a route that is going to work good, right? And so the body's doing exactly what it needs to do. So what we have her doing is we have her on a protocol that we can get all these detox organs to open up. In addition to the adjustments, we're going to get it all open, and we'll use it to guide and monitor the process of her body's ability to heal. You see how amazing that is? It's like a really awesome way to be able to track how are we doing now. We'll give it 3 months and we'll go back in and we'll retest. She'll know because her breast will actually, you know, it'll stop, things will start doing better for her, right? So anyway, that's one of the things that I really love about the test. These are 3 very important things that you can't do with a traditional mammogram, right? You can't do that. You can actually do those 3 things with this test. Here's the areas that you can see that we can evaluate for the thermography, right? So we usually think of breast, right? That's the number one thing we think of. Ovaries, I had a lady who, interestingly enough, we did her scan and she was told by the medical doctor that she had ovarian cancer. And when I did her thermography, there was no ovarian cancer on there. What it showed me was that she actually had a serious digestive problem. Organs are similar in that area, and it created some inflammation in her ovaries. But the issue wasn't her ovaries, so they were starting to do treatment on her, the traditional treatment, chemoradiation. And I'm like, no, you don't stop the press here. We're not going to work on the ovaries here. Look at it, it's your digestive system. We need to work on that. We need to get that moving. She's like, yeah, well, I'm having trouble in that area. But I just thought, you know, he told me it was my ovaries. So see, we can use that for the ovaries. It's very, very, very good test for that. Uterus, heart. I had a lady come in and her scan came in and it showed that she had some severe things going on in her heart. And so when she went back to her cardiologist, she found that they had done a procedure. Something about the procedure had like dislodged or broke or whatever. And this test showed that things were not going right in there, so they were actually able to address it. So it was a very good test just to be able to see what was going on with her. She didn't even know. You know, she came in actually thinking she was getting the thermography for one reason, and we found the other thing. So she was able to address that issue. Thyroid, another really good thing. I actually have a lot of people come in to see me and they have thyroid dysfunction is pretty popular, right? Treatment for thyroid is very popular. A lot of people have hypothyroid. They feel like they can't lose weight because they have hypothyroid. The test comes back many, many times that for people who are thinking that they have a thyroid issue, it comes back many times that it's an adrenal problem. So you're taking a thyroid medication to try to address an adrenal problem. And you'll never get where you want to go when it's the adrenals, right? It's totally two different functions, two different glands, right? So another really good thing. I'm going to get into the teeth quite a bit here toward the end of this and get into the teeth a little bit more. Share with you my story about my teeth and some things that I found. Lymphatic. One of the things that I found on my tests, we actually opened a clinic in Zimbabwe, Africa. And through the process of being in Zimbabwe, Africa, we drank the water in the bush. Have anybody ever been to Zimbabwe? Don't drink the water in the bush, okay? We did it accidentally. Brushing our teeth, we got the water that way, and so we got sick from that. And so my tests that I did showed that I had parasites all throughout my lymphatic system. And so talk about not being able to sweat, when you exercise, and not being able to dump toxins. The lymphatic system is very important for your body to be able to move and mobilize toxins out of the system. And so that was really important. We can catch a lot of lymphatic, potential lymphatic cancers by seeing the congestion of the lymphatic system and getting that moving by this test. Sinus, I told you the story about the lady with the sinus. Colon, we can see bacteria. We can see, I like to marry this with another test that I do that's called the metabolics testing. It's a blood and urine test. It's pretty incredible to see on this test when it shows that you have a food sensitivity or you have bacteria in your digestive tract. Then I marry it with the blood and urine test, and it tells me what bacteria exactly. And if you have a fungus or something else, then I can actually marry the tests. And it's a good way to be able to see what other tests you might need to have done and what procedures that you can do to be able to help your body remove any interference to its ability to heal. Kidney, prostate. I've caught several prostate. I have one guy that we actually did his exam. The infection went into his digestive tract, and the digestive tract was infected, and so it was leaking into the prostate. There's a connection there. When they do the prostate exam, they usually do the colon and the prostate. And so the infection had gone from the tooth to the gut to the prostate, and when we were able to, he actually ended up pulling the tooth. We did a protocol to clear up his gut, heal the tooth. Prostate was fine, he didn't have any other issues after that. So that was a really good, young guy too, really, really good way to test that. Liver, again, you can see if your liver's congested and maybe you're trying to detox from things, but the liver's congested, so we can make sure to open that up. Gallbladder, pancreas. I've seen full-blown diabetes on this test, people that didn't even know they were diabetic, so we've seen that. Stomach, small intestine, and spinal column. I've had several patients that their spinal column shows up and their thyroid shows up. And so the nerves in the middle part of your neck right here actually go to your thyroid. And so both showed up, and so we started a protocol working on correcting the spine and correcting the nerve interference to the thyroid. And by actually doing that, the thyroid turned back on again, and when we retested, it was nice and clear. Another way to be able to kind of see and track the process on there. So moving into mammograms, do you guys know about 2D and 3D mammograms? Okay, so what they used to do is 2D mammograms, right? And so when they do the mammogram, they squish the breast down in there, and it actually creates 1% every year risk. So by the end of, if you do what they tell you to do, by the end of 10 years, you've actually increased your risk of having breast cancer because of the radiation per breast. That was with the 2D. Now they're actually doing 3D, and many times they're saying to do the 2D and the 3D. So they're creating so much radiation on the breast by doing the 2D and the 3D radiation. You're actually setting yourself up for cancer in the breast tissue by all the radiation that you're getting in there. In fact, when they smash the breast down in there, they actually can create a spreading of the cancer cells. I don't know if you guys know this, but in Switzerland, they actually stopped doing mammography. They found that it didn't reduce the overall death rate, but it increases the overdiagnosis and leading of false positives and needless biopsies. Now in that, I think that country, they have more of a socialistic kind of system, so they care whether they, are doing all these tests in the area, right? So it's interesting to see that they're even recognizing that there's a lot of false positives and how it's creating a lot of false treatment. Another thing about the mammogram is it actually causes a 4 to 6 time increase in the mutational damage that can show up in breast tissue as well. So it mutates at 4 to 6 time rate by doing those tests. They actually have 43,000 women per year who are overdiagnosed and overtreated. And interesting about that is that when they overdiagnose them or they misdiagnose them, people who get misdiagnosed and then they correct the diagnosis or they go through a treatment process that they shouldn't have gone through, they spend so much time worrying about the misdiagnosis and being so wrapped up and concerned with it that it actually causes them to have symptoms as if they had cancer because of the whole brain, the worry, the anxiety and that kind of stuff, the nervousness and stuff that goes on, and the worry that goes on with people who get misdiagnosed actually is equivalent to actually if they would have had cancer. Now diving into the dental, this is one of the what it shows you on the test. It'll show you which teeth, and you can see which teeth, so that way you know you can go back to, some of you will go back to your own dentist if you have a good dentist, and some of you I send to a special dentist that's a biological dentist that actually someone who really knows how to take care of some of this stuff that's pretty deep. In fact, I will tell you my story. I'll show you which tooth actually was involved. I had 2 teeth that had crowns in them, and remember my mom told me I should take care of my teeth, and I didn't do a good job when I was a teenager, so it kind of bit me when I got older in life. And so I ended up having one of them, the root canal got infected, just like the other patient I told you about, and it was trying to come out the side. So the infection was just like the lady with the breast. The infection was trying to make its way out, so it was actually on the side of my mouth. It was coming out the side of my teeth here. And so the infection was trying to make its way out. Well, what happened was that particular tooth, number 4, you can see there, actually caused the infection to go into my lung. And so I've never smoked, I never did anything like that, but I couldn't figure out what was wrong with my lung. I kept having this gurgling kind of sensation in my lung. Nobody could figure out what it was. I went to homeopaths. Nobody could figure out what that was. When I did my thermography, I found that the specific tooth that had the root canal that actually was trying to make its way out, that tooth was connected to my lung. So I actually went to a special dentist. I actually had to fly to Miami that could actually do the type of procedure that I had to have done. And they actually had to go in and pull everything out, retreat it. It was a big mess. But after I went through that whole process, literally when I was in the dentist chair, after the second procedure that I was in there, the gurgling in my lung was completely gone. And I knew, like, that infection was gone. But this had been going on for years. I didn't know. It was only one day that it just kind of popped out. So I'd been living with this, like this lady that I told you about with the eardrum. I've been living with this, not trying to figure out what the heck. Well, it was a procedure that I had done. Basically, I had 3 roots, and one of the roots never got treated. So that root was the one that got infected, and it was trying to make its way out. So the body was doing the right thing, right? And the infection went down into my lungs. And so I could have ended up with what kinds of diseases that you have, with lungs. I could have ended up with all of those things, right? But because we did this test, I was able to identify and find the cause and then go to a proper dentist to be able to help treat it. So some of you will need to go to a proper dentist to be able to work on some of this stuff. But you can see here, pancreas, I think you mentioned pancreas, right? You can see here the right and the left and which tooth, every tooth has a number, and you can see the organ system that's involved in that. And in fact, I have this on my website, Herb Family Detox. If you go to my Herb Family Detox website and you go to the tooth, there's an interactive tooth. So you can actually just hover over the tooth and you can see which tooth goes to which organ system. And it'll be interesting, go home and just check your teeth and look and see which one you have some issues with and count it and then hover over it and see if you have any organ dysfunction that goes along that's associated with it. She's like kind of picking in her teeth right now, like, which one? Okay, so you guys can see how this works. I actually had another patient who was a doctor that came to see me, and her scan came back, and she actually had mercury toxicity, right? So she had mercury toxicity. Normally you think of mercury toxicity and you think of, and this patient also had like serious headaches all the time. So normally you think of mercury toxicity, at least I do, you think of silver fillings in the mouth and lots of vaccines, because vaccines have a lot of mercury in them, right? Well, in her case, she had dental toxicity. The thing showed severe dental toxicity, right? And she didn't have one cavity in her mouth. She didn't have one filling. Now that's pretty unusual in itself, right? But she didn't have one filling in her mouth. So stick with me on this. Like, this is the process of trying to dig through, how does one have dental toxicity without a silver filling? So we went back through her history and we found out that she had your molars removed. You know, the surgeries that they do, they remove the molars, right? Well, she had her molars removed, and when they removed the molars, they got impacted. So she's actually had for 12 years, two very important things happen. She had this regularly, one tooth would pus, the molar piece. Pus would come up, it would be there for a little while, and then she'd have one other tooth, pus would come out, it'd be there for a little while. And the other common interesting thing that she had headaches, right? She had heartburn. Burning, burning, burning heartburn. And so she was 18 when the heartburn started. That's when she had the procedure, right? And all the way up until 30, till we started to get to the cause of these things. So this was her situation. Dental toxicity wasn't because of the silver fillings in her case. It was because of this infection that was in there, right? And so guess what this infection did? It actually created Lyme's. Because your teeth, if you don't take care of your teeth, that's where Lyme's disease can actually start to wreak havoc, because you don't floss, you don't take care of your teeth, or you have an infection there. Critters start to grow. They like breeding grounds for like dead stuff, right? And so that's really what's happened with her, right? Now she's getting to the cause of it and she's working through it, right? So this is really powerful to be able to see these areas of the teeth. Again, check out Herb Family Detox. You guys go home and look in your mouth and your teeth. I'd do that if I was you, and just see which tooth, just kind of play with it a little bit. You'll get to, we'll do your test anyway, but it's still fun to kind of go through and see that. Does this help you guys? Okay. So this will show you before and after therapy. So you can see on the left-hand side, this was a scan that I did of a patient, and you can see just from where you guys are, what jumps out at you when you look at this left side. The red, right, jumps out at you on the breast itself, right? And then what about in this chart? You see the three lines that are really red jumping out on there, right? So we have breast block spot, distant related focus, and we've got mastopathy, inflammatory, right? So we take her through a process, and through the 5 essentials, through the adjustments, through her detox, getting the detox organs working on, you can see the blocks right here, see the check marks right there? Liver and lymphatic was blocked. So guess what we need to work on? Liver and lymphatic, right? We need to make sure we got nerve supply, so we're getting her adjusted so that the nerves that go to her liver and her lymphatic is lower neck, liver is upper thoracic, right? So we make sure that the adjustments to her nerve supply, the area actually open, so that then the liver and the lymphatics can do what they're supposed to do. They're unblocked, right? So we worked on that. We also worked on some cleansing. I did for the lymphatics, we did some skin brushing, right? Have you guys ever heard of skin brushing? So we did some skin brushing, right? And we gotta be consistent with that. I also had her get in a sauna and make her start sweating, right? Because she couldn't sweat, right? And so we worked on a liver cleanse. And then you can see the rest of those 3 spots, you can see are all breast related. So even through the lymphatic, like when we do a skin brushing, we're skin brushing the breast too. We're brushing it all, brushing the arms, the legs, the breasts. That's what we're doing. We want to make sure to get the lymphatics moving in the whole area, right? Now through that process, then we retest, because again, this is a way to monitor a patient's healing, right? We use it to monitor their healing. So you can see after 6 months of going through her treatment in the 5 essentials, you can see the liver looks like it still needs some work, but we actually have 4 spots, and you can see only have 1 red bar. Are we moving in the right direction? Right? So typically people who have these breast block spots like that, they're going to go down the route where they biopsy, they cut things off, they chemoradiation. This person's not. They're moving toward healing, right? So we didn't even do any of the chemicals. We didn't even poison or do any of the other stuff. This person is actually healing and moving in the direction of getting total healing, okay? So that's another really fantastic way. You can see much less red on there. The bar graphs are happy. Orange is gone. This red is gone. In fact, look at it's normal. The distant related focus is still there, but the breast block spot is gone. So it's a fantastic way to be able to see that the body is actually healing. Okay, I showed you kind of a little bit about the test, kind of gives you an idea. I showed you kind of the visual of what the test looks like. You can kind of see all the different colors on there, different parts of the body. I don't like the red, I don't like the yellow. See how the yellow kind of jumps out at you on there, different organ parts. You can see the heart kind of involved in the area. But it gives you an idea of what we're looking at, the different teeth that we need to look at. It's nice because you can see tooth 10, 11, and 12. We may have some kidney, bladder, liver, gallbladder, lung, large intestine involved. And so this gives us an idea of how to arrange our recommendations as far as detox and treatment that we go through, okay? Again, another bad test that we went through, and the patient, if you look here, you can see she had like six spots on there, and that's actually suspicious, more of a suspicious test that we are concerned that maybe a diagnosis coming up. But if you align it with the x-ray like we talked about, who knows the nerves, where the nerves are in your spine that go to your breast? Anybody? It's going to be right here in your neck. So kind of that space right here in your neck, okay? And if you look at the x-ray, does everybody recognize what this x-ray looks like? Okay, so the x-ray, what should the neck look like? What should the curve look like? Should have a nice 45-degree angle on there, right? So this patient, instead of 45, she's got a 21-degree curve. So she's lost a lot of the healing power to the nerves that go to her breast. So you can see how this type of test would show up. Now, when we go through a process of healing this through the spinal correction program that we do in the office here, you retest this, and you retest this, and you can see the body's moving in the direction of well-being, right? This is just a fantastic way. You don't see this stuff. People won't get well from this. They don't. They don't get well. They just normally get on a medication and they stay on the medication the rest of their life, right? But these people actually get well. Again, kind of you can see the bar graphs there. You can see where the bar graphs unpack the global immune stress. Cancer is an immune system disease as well, so we don't like it when it shows immune system distress. So we really have to do some things to make sure to open up the immune system and heal the immune system, okay? How do I prepare for the appointment? We actually have some things to prepare for the appointment. I'm going to just hit them with you for those of you who haven't done the test before. You want to make sure that you come wearing comfortable clothing. We talked about that, not constricting clothing. Button-up shirt, long pants is best. You want to make sure you don't shower or bathe the morning of the test. Don't put body sprays or lotions or creams on your body, and don't wear makeup. Take your makeup afterwards.
Not even deodorant, right?
Take it after. No deodorant. Take it afterwards. Don't drink coffee, black tea, or caffeinated beverages. The tests are done in the morning times. Mostly we can't do them past 1 because your body temperature changes so much after that. So we actually only do it from the morning until 1 o'clock. So that's the time frame. Come hydrated. Don't exercise the morning of. You don't want to have a dental appointment the day before either, right? That's kind of obvious. Your period, you don't want to be on your period, the first or second day of your period. So glasses, I hit the glasses. Cell phones can't be in there. We don't want to have cell phones in the appointment because it actually, the EMFs and the radiation from that. You don't want to drink alcohol prior to the test. Not too hard, right? That's not a whole lot to prepare for, but there's just some things you want to do to make sure to prepare for the appointment so it actually goes well. Bless you guys. I'll be here if you need anything else. I hope this was helpful for you.